I've been diagnosed with diabetes for almost 25 years. So I can remember that number because I was pregnant with my daughter and
Mhm,
I had gestational diabetes. I said, oh, it'll probably go away when
mhm.
you deliver. Well, it didn't. I remember the shock because I was young and I wasn't overweight and I didn't, air quotes here, look like I had diabetes. So I was really
Mhm.
struggling with that. All right. Welcome to this month's Roundtable Live. We are excited. I should be more specific. It's the Public Health Roundtable Live. And this is November 1st. Happy November. And November is, there's a lot of awareness that happens in the month of November, but we're here to talk about diabetes awareness here in the United States. And I know a lot of aspects globally, but we're going to talk about diabetes awareness conversations. It's really about how are you communicating, how are you having the conversation about diabetes with your communities, and that could very much from different community groups to different community groups. So I am Dr. Charlotte Huntley. I'm the CEO of Dr. CH Huntley LLC, and we are a public health consulting firm that really supports large nonprofit organizations, typically the ones that serve BIPOC communities. We help them with really communicating their data, helping to make that health information more easily understood, communicating it in plain language. Sometimes that's within departments of these large organizations, and sometimes it's to the communities that they serve. So, I am also the host of the Public Health Epidemiology Conversations podcast. We have brand new episodes every Tuesday. So, I'm excited about that. We started in late 2017. So, a lot of episodes to date. I am joined by oh gosh, I'm already speaking doctor into your future.
Hey, I received that.
LaShonda Richardson, who is the founder of EMERGE LLC, and she is going to be sharing. She's an expert in this topic, and we're going to be having the discussion. So, LaShonda, introduce yourself and tell everybody what you do and more about EMERGE.
Hi, my name is LaShonda Richardson, and yes, I am the founder of Emerge Public Health and Community Development. Emerge the strategic planning for businesses and organizations to evaluate resource effectiveness as it pertains to health and wellness. We work with organizations, we work within the community to make sure that individuals have trusted resources to be able to make more informed decisions about their health and wellness. So I'm very excited to be here today to join in on this discussion.
I also just realized that we're Carolina neighbors. I'm in South
Yes,
Carolina, you're in North Carolina,
in the
so
South.
yes. Yeah, thank you for taking some time and being on the roundtable with me today. I know that we were chatting a little bit before we went live, and you were talking about how you're rounding up a big event from October in breast cancer awareness, and now you're jumping right into diabetes. Uh,
Yes.
so really important work that you're doing, and excited about that. Before we dive too far into the topic, which is really all connected, thinking about diabetes awareness, I know that that's essentially your business kicked off with a big diabetes event and you're getting ready to go into that again. So let's start a little. I'm going to dive a little bit more into your background because I think it's really connected to what we're talking about. How did
Mhm.
you get started and why did you choose like that diabetes campaign? Tell me a little bit more about that.
Yes, I did an event. I kicked off an event last year and I entitled it Sweet Talk. And it was a diabetes awareness event. And diabetes awareness is a little more personal to me because I have so many people in my family that have suffered with the disease or the disorder. So I think it's very important to ensure that people have the right resources and that they understand that certain lifestyle changes can help to reverse the diagnosis of diabetes. I just have seen family members suffer with heart disease and kidney failure and things of that nature. So I want to make sure that for my family and for that my community that we have the information to know to share with our doctors and to share with each other to be able to reduce the numbers of people that are suffering with diabetes.
Yeah, I agree. It's important work and for me it's personal as well. I know that when early on started watching my family, and when I started really understanding before I even understood public health, I just knew that
Mhm.
I was upset about how often I heard of a family member that had diabetes, and
Mhm.
I watched my mother and my aunt give my grandmother injections in her thigh, and I kept wondering, "Why does she need to get these shots?" And it was her insulin, and I
Mhm.
watched my mother cook these special meals. She did all these things to for my grandmother, trying to take care of her, with diabetes, and then my mother had diabetes, for as long as I can remember, so she did things differently with her lifestyle that so she lived to be 90, and she recently passed away.
Wow.
I shared that with everyone, but it wasn't because of complications of diabetes, it was something else. She did a great job of managing diabetes through lifestyle changes, nutrition, and exercise, and she was very cooperative, proactive. She talked and worked
Mhm.
with her care providing team to make sure that she did all those things to ensure that she could live a better quality of life that at an older age than like my grandmother. So myself, I've been diagnosed with diabetes for almost 25 years. So I can remember that number because I was pregnant with my daughter and
Mhm.
I had gestational diabetes. And I said, "Oh, it'll probably go away when
Mhm.
you deliver." It didn't. And I remember the shock because I was young and I wasn't overweight and I didn't, air quotes here, look like I had diabetes. So I was really
Mhm.
struggling with that. And I was in denial for a long time. And even as a healthcare professional at that point in my career, I still didn't want to hear that. I did what I was told, but I didn't want to have the conversations. There's a point where, like, the walls, you go up and you're just like, this is really not
Right.
me, but I'm going to keep taking this stuff because they said I need to.
Mhm.
And then I got really opened my eyes and started implementing a lot of changes in my own life. But I've always, even to this day, I'm perplexed because I feel like there's so much work that needs to be done in how we communicate and how we have the conversations. Yeah, it's very personal. It starts there, but that's what keeps you revisiting this. You can't let it go
Right.
completely. So tell me about the events. What happens at the events for the community?
So at the events, I have a physician assistant. Her name is Rita Brewer. She actually teaches about the diabetes reversal formula. So she talks about those lifestyle changes and how to eat healthy and reducing stress and things that can assist with reversing the diabetes diagnoses. And so in these, she does a presentation. She's been a physician assistant for over 30 years. So she goes in and she also talks from a personal perspective. Her mom and some of her family members is the reason why that she began to do this work. And she just goes in to talk about how she was able to help her husband in reversing his diabetes. And so there's a presentation. We also have vendors there that promote health and wellness that are a resource of if you want to get involved with working out or if you need help with how to prepare meals healthier and things of that nature. So it's just a wealth of resources and information that allows you to be able to have the opportunity to do better and to learn and to share so that not only the participants that come and are a part can get that information, but that they can go back and take it to their family members and to their communities and share their information as well.
How are you I think that's wonderful, and I'm just thinking 2 parts, 2 things. I have a question, but before I ask the question, I'm gonna add to what you were saying. I know a lot of people who've been able to reverse their diagnoses, and I used to be
Mhm.
really, like, envious because I would try everything, and I have a long history with my primary care provider, so we she really knows me well, and I go in and I'm just like, I'm really meticulous about everything I do with physical activity, which is why if you listen to the podcast or familiar with me, I love walking and hiking because that's like my
Mhm.
exercise of choice. Like that helps me to keep my numbers really low. I have changed my diet primarily motivated by trying to reverse diabetes or really control it, reduce this amount of medicine or just those I wanted to get to the point where I didn't need any medication
Mhm.
and I would try everything. And she told me, she every now and then she'll remind me, but she told me that if it doesn't happen for you, it's not because it's your fault or anything wrong. It's just
Mhm.
not it's not that you should feel defeated. because you're maximizing everything that you can do. And for a lot of people, it will reverse it altogether. But for a lot of people, it will just reduce those negative implications and reduce the more severe progression and slow
Mhm.
progression. And I had to realize, okay, that's still a win for me.
Mhm.
Over the years, it's taken a while, but over the years, I have gotten to that point. So for me, I haven't been able to get the reversal, but I've been able to reduce that amount of medicine. And there are times that it's had to adjust, but we're talking over 25 years. I've done really well. There's only one time that I actually had to have insulin, and that was because I was hospitalized and had an NG tube and could not like eat. So every once in a while they would need to give the insulin, but not very often because again, I wasn't eating. But I've not had to do the insulin from home. Not that there's anything wrong if I would have to, but I'm just saying that at least I feel like a lot of that's contributed to the fact that I've had all these adjustments. And this kind of leads into a lot of what I want to talk about because there's some people and we do have our backgrounds on our side, being a
Mhm.
healthcare professional and understanding it from a professional perspective. But folks that are not health focused and don't have the understanding, there can be a real wall and not being able to understand some of the things, some of the lifestyle changes that can impact diabetes. And I'm wondering how you were able to communicate that to the community to build the trust
Mhm.
and for them to come in and participate and actually want to hear that and then go back and implement that. What did you do to communicate that and to build that trust in the community?
So I think a lot of it is meeting people where they are and understanding that how you were talking about that wall
Mhm.
can come up if you're when you're coming to say you can't or you have to do this and you have to do this and you have to exercise and you have to sleep more and you have to it's just so much coming at you at one time. So I think is meeting people where they are number one, and then teaching people to celebrate small wins. Just as you were talking and you were saying you're doing what you're supposed to do, you're eating healthy, you're changing your diet, you're seeing some progress, celebrate small wins. We know that obesity is a factor in type 2 diabetes or in diabetes. And so when you're working out, sometimes you may not see the weight come off as fast as you want to, but you may see that your clothes are fitting better, like you're losing inches or you can walk that extra mile. So celebrating those small wins that you're doing as you are progressing and teaching people to say that you don't have to tackle everything at one time. Take your time and work towards getting the goal. And I think that when we meet people where they are and we teach them how to make small changes that will implement these results as they go, I know for me, I'm a results person. So once I see that something is working, I'm like, okay, let's, this has worked. Let's try the next thing and see what results I get with that. And so I think helping people to understand like you don't have to tackle everything at one time, but those small things that you're willing to do, you will start seeing those gradual results, and ultimately you'll look back and see, oh, I was able to do this, and then it gives you the courage to move on to the next thing. So I think getting people to see that if I can make these small changes to get to a better place, then you can gain their trust. You can gain getting in and just meeting them where they are and having those conversations on what they can do next.
I think that's great, a great point, and it's true. Sometimes it's overwhelming to think about, "I've gotta change all these things."
Mhm.
So sometimes I've had conversations with family members, and I can remember when it comes down to being overwhelmed about all the things, because it's easy to go straight to what I can't have anymore and I can't
Mhm.
do and to be very negative, and that's like shift to one family member, we had this conversation about just the drinks. I said, if you simply remove sodas,
Mm.
sugar drinks, and replace it with something else, you don't have to
Mhm.
go straight to drinking water, straight water all the time. You can try something else. And I said, have fun with it,
Mhm.
explore, because there are so many different varieties and options for drinks that you can have that aren't sugar drinks or sodas.
Absolutely.
And they went off with that. They had fun. Like, I would get random pictures. "Look what I just found. Have you tried this?" So sometimes being able to twist that around, and that's something that it's seemingly small, but also like your perspective on it. Don't look at it like I grew up in a culture where we celebrated with food. Our family gatherings had.
Church.
Yes. Exactly. My mom was that
Everywhere.
person. After church, she invited everybody to our house. It was
Mhm.
ridiculous, and we never had a shortage of food. There was food everywhere, so I grew up loving food, good food,
Mm,
and I never wanted to sacrifice that. So I remember feeling that, I was gonna give up all these things, and even later, like in the last, I say, 10 years, I've really played around with different food. I was vegan for several years. I've been
mhm.
pescatarian. And it's really about me trying to figure out what my body responds to best. So I just felt, okay, I'm never going to sacrifice good flavor. Good taste. My food, it has to taste good. There has to be a really nice
Right.
presentation. I have to be able to get excited about, this plate of vegetables or whatever it is. So I just felt like when I turned it around and I started really looking for a different outlook, a more positive outlook, instead of thinking about what I can't have, just thinking about all the things I get to try, and the things I hadn't tried before. And it really helped me to celebrate the wins, but also just reframe
Mm,
how I approach it. So my sister will text me at least 2, 3 times a week with some food picture when she tries a
mhm.
new like fruit or vegetable and show me what she's done. She's still inspired by the
Awesome.
way. Yeah.
Yeah.
She's still inspired by that journey. So I think that's another thing we can just, like you said, with meeting people where they are, is also helping them to not see it as a loss of what they can't do or how they're restricted, but just really think of it as a new opportunities and new things
Mhm.
that they can try. So
Yeah, I agree. It's a mindset shift. And like you said, it can be so fun to just try different things. I know with my husband, like he's the type that wouldn't try anything. And that's how it is even like growing up as a kid, Brussels sprouts or something, you're just like absolutely not because it looks gross, it's not whatever. But then sometimes when we try new things, we find out we like them, and
yeah.
so it's just being open-minded to trying new things and to
Mhm.
exploring different things. So yeah, I definitely think that it's a mindset shift.
Yeah. I'm watching my time because I could chat about this for a long time, and I know with LinkedIn Live, thank you for all that are watching live and that are watching the replay, and we'll be sharing this on the podcast, so thank you for all of the people that are listening. We want you to share your comments, your thoughts, your ideas with us as you listen and things come to mind for you. We really want to have you engage with us in this conversation. We'll be back in the comments and following up on anything that you share with us. So I was just thinking about how we can help people who are there are a lot of people who are afraid. Like they feel something in their body that tells them they might be diabetic, or they're feeling something that's not quite right, and they're afraid to get the official diagnosis. And the reason I want to talk about how we can help people in this way, because not too long ago, I had this conversation. I cut all my hair off earlier this year and went natural, and I've kept it really low. And I started going to the barbershop, and which is like a whole new thing that's real giddy for me. But in public health, we talk about these community partnerships, and there's the barbershops, the beauty shops, and how the relationships are there and how conversations can happen, and that can be really health focused. In the barbershop, I've been able to my barber calls me doc. So when I come in, it's doc, and I've built a bit of trust. So they whatever the conversation is happening when I walk in continues. So sometimes I really don't want to hear the conversation.
I can imagine in the barber shop.
But I keep reminding myself that they trust me enough that they don't switch it around, but they let me they continue their conversation around me. But there was a time when I went in and my barber goes, I can't remember the other barber's name. There's 2 or 3 guys in there at the same time. There's one right next to where I normally sit. And he's apparently we're talking about it before I came in. He says, "This is Doc. She can help you." And he said, "Do you give free advice?" And I was like, that was like such a wide open question. I was afraid to go in the door. But I was like, "Oh, what's on your mind?" And then he started to say, "How do you know how do you know if you have diabetes?"
Mhm.
And, like, in that moment, I was scrambling because I didn't wanna just start throwing out jargon, and I didn't want to do anything that was going to appear to be judgment. So I kept reframing. This is where I guess my coaching background helps me because I kept reframing and putting the question back to get him to talk more. I just talked about some general symptoms, and I said, "You may feel this, you may have it, like, really thirsty, extreme thirst." And he was like, "Yeah," like he's thinking it as I'm mentioning it. And I said, sometimes these symptoms can be confused with other things going on too. And I mentioned a few things like if you find that you have to get up, frequent urination. So sometimes during the day, you might not notice it, but if you notice you're having to get up during the night a few times,
Mhm.
you say, yeah, that's been happening. And then we went into a few things like, do you feel like real strong cravings for something sweet and sugary? And so we were talking about a few things, and he was just kept nodding his head as I talked about it. And I said, the only way to really know is to go to your doctor and talk to your doctor
Mhm.
about what you suspect and have it's a simple blood test. And I began to explain the simple blood test. And he I could tell he was afraid. He was afraid to go through the process. What happens if they say I have it? Then what I have to do? And I said, there's a lot of different treatment options. And I didn't go too far into trying to be the medical doctor because that's definitely not me. But I was
Mhm.
absolutely all in my public health realm because this is about educating and about having this conversation. And everybody in that shop was listening. And I just kept re, I just tried. My goal was just to encourage him to go have the talk, to have this conversation with his medical doctor, his provider, and I gave him a lot of ideas of what to expect in that visit so that anxiety would be reduced. And then I gave him like one or two kind of easy resources I thought were easy reads to explore. And then every time I saw him a couple of times, he thanked me there. And I wanted to go further and I just kept saying not too much because I didn't want to overwhelm him. But
Mhm.
um he brought it up another time. I honestly don't know if he's gone to this point. The last time I saw him, I don't bring it up every single time I see him because I don't want to make him uncomfortable. He hasn't asked me any more questions, but I did ask him the last time I saw him. It came up and I just said, "How you doing?" I said, "Did you ever follow up with your doctor about what we were talking about before?" And he's, "Not yet, not yet, but I'm getting close." I said, "Okay, when you're ready." I didn't judge him. I just
Mhm.
wanted him to be aware and to encourage him to do so. That's been several weeks. I don't know if he ever did, but I tell you that long story because sometimes we can get caught up in like the details of way down here, but sometimes at that very early conversation where people are too afraid to even get checked because he was pretty young. I'm thinking maybe mid-30s,
Mhm.
and so I just am curious, how do you approach something like that in terms of those early conversations where it's it seems super simple, but it's a
Mhm.
very fragile point where the conversation needs to happen, but you don't wanna do too much, you don't wanna ignore it. What advice do you have in there?
My advice is to plant the seed. I think that you planted the seed when you were able to give him some direct information. You were able to tell him, what to look for and the next steps to go as far as getting tested and everything. So I think that is important. Sometimes people are going to be afraid. It may take people a little bit longer to take action steps once you give that information. But I think that planting the seed and giving people the opportunity to learn more and to gauge their interest. And it's like important because, like you said, everyone was listening. So at that point, you planted multiple seeds because some other people were just probably not even articulating how much you were helping them or how that may have triggered something in them to go. So while he may not have gone, someone else may have gone and not told you. And I think that's the important thing in our work is making sure that we're planting the seed because people are listening and people do want to we have people that do want to do better. They just don't know where to start. Or like you said, that they are afraid. And what I encourage people to do is to do it afraid because sometimes we have these resources and we don't get tested. We really don't know what it is until we go when we talk to our doctors and we ask those questions about the tests or the things that we need to do. But in the long run, it benefits you, it benefits your family to know what is going on and what you can do to be able to prolong your life or live a more sustainable life. So I do say plant the seed because people are listening, and then to tell people that to do it afraid, and you don't have to go at it alone. You can talk with another family member, or we are public health professionals, but there's community that is here to support you in doing that and asking the question, answering the questions that you have. So do it afraid because it benefits you in the long run.
Yeah, yeah. Great tips. I'm gonna I'm watching my clock, so I guess I'm gonna wrap this up. But this has been great conversation. I feel good about being able to talk about this on this platform and sharing with our colleagues that are listening and may also be thinking about some of the things that we've shared in this really kind of peeling back some layers, humanizing the population, the people, the conversation, the importance of it. And maybe it's helped some of our colleagues to soften their approach even, or some tips for how to communicate with the communities that they work with and serve. So thank you, LaShonda, so much for coming in and talking with us and just for all that you're doing. I'm excited about what you have coming up as well.
Yes, thank you so much for having me. Yes, we're going to continue the conversations. We're going to continue to speak with people and spread the word and give resources so that everyone has the opportunity to make those better decisions in their health and wellness and reducing these numbers for this diabetes.
Yes, absolutely. Make sure that you're connected with both of us. You see our
Yeah.
names here on the screen, and continue this conversation in the comments. Share your thoughts, your ideas, your feedback, your what you've tried and suggestions. Let's keep this conversation going throughout the month of November and beyond, but especially during Diabetes Awareness Month, where folks are really putting attention on how to have these types of conversations. All right, we'll see you all next time.
Absolutely. Bye. Thank you.